Hi, welcome to Ask Dr. Tan. So this is a new series where we look at the questions that you ask us on our social media platforms, and every week we pick a topic and we try to answer your questions as best as we can. So this week the topic is actually on HIV, which you all know is a huge topic, but let's look at what questions we were asked. So the most popular question from all of you was, what are the early signs of HIV? Okay, so a lot of people ask these questions because I guess they're anxious after an exposure and they're always checking their bodies to see if they could have been infected. Now, before I answer this question, I have to tell all of you, please do not rely on signs and symptoms to determine if you have caught HIV or not. The best thing to do is to still go and see a doctor and get yourself screened and tested. Okay, so let's try to answer this question. The most common signs of HIV that a study in Singapore published, you'll be surprised, actually mimics that of dengue. So what are they? Fever, rash, diarrhea, and a sore throat. Okay. Usually happens as early as 2 weeks and up to 6 weeks post-infection. So in my experience, having seen a lot of patients, the fever is usually significant, more than 38.5 degrees, and Panadol brings it down temporarily, but it comes back up. The rash is usually very significant, involving the face, the upper chest, and it's something that not only you would notice, but usually the people around you would notice too. And of course, a diarrhea and a sore throat. Now, this may not be a typical sore throat. Something that's a lot more suspicious is actually multiple painful small ulcers inside the throat. But again, please don't try to diagnose yourself by looking at signs and symptoms. If you think you've been exposed, please go and see a doctor and get properly screened. Second question is, are bottoms at higher risk of HIV? Okay, so I guess it's a bit of a technical definition. What we understand by the term bottoms is people who have receptive anal sex. That means people who allow their partner to insert his penis into their anus. So this is regardless of gender. But when we use the word bottoms, there's a nuance to kind of refer more to men who have sex with men. So are bottoms at high risk of HIV? Unfortunately, yes. And this has been reported across the board, from the FDA to the British HIV Association to the Australasian Society of HIV Medicine. The statistics show that people who have receptive anal sex, that means people allow their partners to insert his penis into their anuses and ejaculate without a condom, is at higher risk of HIV. That's obviously assuming that the partner is HIV positive and the partner is not on treatment. Now, this is very important. If a person is HIV positive and on treatment and his or her viral load is 0 or undetectable, then that person poses no risk to the partner. Okay. Now, the third question is, does PrEP protect me and my partner from HIV? So for those of you who don't know, PrEP stands for pre-exposure prophylaxis. It's a medicine that people take regularly to protect themselves from getting HIV. Think of it as a contraceptive pill, but instead of protecting you from pregnancy, it protects you from HIV, right? So the answer to this question is yes. So many studies have shown taking regular PrEP, taking this tablet every day, can reduce a person's risk of contracting HIV by up to 99%. And if a person is protected from contracting HIV, then obviously we are protecting his or her partner from contracting HIV also. Now, PrEP is actually one of the very important pillars that we have these days to try to end the HIV epidemic. Many clinics in Singapore and many public hospitals in Singapore have PrEP clinics. It is something that all of you should think about and consider if it fits your lifestyle. And go and talk to your doctor about it. Now, HIV PrEP is a very good tool in stopping the HIV epidemic. So that wraps it up for this week. We'll see you guys next week for the next topic.